Thank you so much for having me. Today's talk is for three kinds of people. The first kind of person has some kind of chronic neurological disorder or any kind of chronic disease like Parkinson's, high blood pressure, diabetes, neuropathy, migraine, basically any disease that doesn't have a cure, and you're made to take medications every day that make you feel fat, tired, dopey, goofy, or just plain evil, and you know who you are. The second kind of person this is for are for those people who are in okay health. You think you want to do a little bit better, maybe have less depression, more energy. And then the third type of talk, or the third type of person this talk is for those of you who are in great health, but who want to maximize what's going right, and who want to reduce the inevitable aches and pains that are going to be piling on as the years go by. So basically, this talk is for anybody who wants to know what they can do for their health and their lives to make everything a little bit better. The key is in the mind-body connection. And when we talk about the mind-body connection, we're talking about the person as a whole and not just as a disease, okay? So we're thinking about, how do you feel? How do you think? What's your lifestyle like? All of that affects your body. And you can see on this slide, it affects your nerves, it affects your immune system. We know that it can cause increased high blood pressure. Stress, for example, causes increased high blood pressure. It can worsen your sugar and diabetes. It may increase your risk of having an MS relapse and possibly more seizures. So it definitely makes a difference. And people know that, okay? Because right now, the NIH estimates that 17% of patients right now are engaged in some form of mind-body therapy, like yoga, meditation, Tai Chi. And in the year 2007, do you know how much money was spent out of pocket just by Americans for complementary and alternative medicine? Just guess. Go ahead. How much do you think Americans spent in 1 year out of pocket on complementary and alternative medicine? Go ahead. Who? Anybody?
A billion.
$33 billion out of pocket. Yeah. So it means something. Oops. So when I talk about complementary and alternative medicine, I stick to three basic tenets: nutrition, exercise, and mind-body therapies. Okay? It's simple. It doesn't cost anything more than just the routine cost of food. There are no side effects, and it can make a difference. And I talk about it with all of my patients at the end of our visit. We spend at least 5 minutes talking about this. Okay. First and foremost, the easiest thing you can do to change your life is to look at what you eat. Food as medicine is nothing new. The Chinese have been doing it for thousands of years, okay? And of course, what everybody knows about, omega-3 fatty acids, right? And they're mainly found in fish. What are omega-3 fatty acids good for? So many things. They're good for stroke, cardiovascular disease, possibly dementia, can help fight cancer, maybe depression. They did a famous Harvard nurses study a few years ago, and they found that nurses who had eaten fish 5 times a week were able to reduce their risk of stroke by half. So yes, it makes a huge difference. Now, where do you get omega-3 fatty acids besides fish? You can also get it in flax seeds and walnuts. Be careful, my men out there, for flax seeds. There's still some evidence out there that it might increase the risk of prostate cancer. So I just say for the men, stick to fish. For the women, if you are of childbearing age or children, unfortunately, because of the mercury content in our fish, you can't have more than 12 ounces a week. And then if you are eating canned tuna, you can only have 6 ounces a week if it's white tuna. It's weird. You would think that light tuna is worse, but it's white tuna is worse than light tuna. Okay, so if you're going to have canned tuna, I would get light tuna and get the one in regular fresh water. All right. So for those of you who hate fish, and I have a lot of patients who can't stand it, you can get it from supplements. I always recommend getting it from food. That's the best way to do it. But if you just can't stand it, you'd rather die than take it, then go ahead and take the pill. Now, there's an alphabet soup out there. Which one do I get? There's DHA, EPA, ALA. Well, DHA and EPA are the ones that are found in fish. That's the one that your body can convert. It doesn't even need to convert it. It just uses it automatically. ALA is the one in more plant-based and some nuts. Those have to be converted. And so we don't know if they're as effective as the other two. So when you go buy it at the grocery store or at the drugstore, you're looking for DHA and EPA, and you can have a 2-to-3 ratio or a 3-to-2 ratio. It doesn't matter. You can flip it back and forth, okay? The regular dose is about 1,000 to 2,000 milligrams a day, or 1 to 2 grams a day. When people start taking about 3 grams a day, that's when you can start getting bleeding, okay, because it thins out your blood. And then finally, some people hate that fishy taste. Does anybody ever talk about, like, when you burp, you get that fishy taste afterwards? To get rid of that, put them in the freezer, and you take one out every morning, and you can eat it that way. Fruits and vegetables, what your mama told you. So fruits and vegetables are, again, they're great for so many things. They've got essential minerals, fiber, they have antioxidants, trace elements that are needed for your body. The American Cancer Society and the CDC, they recommend 5 servings a day, at least. And many of my patients say, there is no way that I can do 5 servings a day. Yes, you can. It's not that hard, okay? So I tell my patients, have a banana at breakfast. Then for lunch, have a salad and maybe an orange or some kind of fruit for dessert. So that's 3. Then in the afternoon, have an apple or maybe baby carrots as a snack. 4. And then at dinner, just make sure you have a side of vegetables. 5. You got 5 right there. That was super easy. So yes, you can do it. And they are good for so many kinds of diseases. Again, they're great for cancer, heart disease, stroke prevention, cardiovascular prevention, diabetes, everything. For the diabetics, though, be a little bit careful. You can't have the fruit as much as the vegetables. When you're picking your vegetables, get the brightly colored ones, okay? And the reason why, the antioxidants are in the pigments, okay? So there was one study looking at spinach. Spinach has been shown to reduce potentially stroke because of the folate content. But patients who took the folate supplement, there was no improvement. So you got to get it from real food. Berries, brain food. Berries actually cross the blood-brain barrier, meaning it goes straight into the brain when you eat blueberries in particular. And they did a study where they found that patients who, or it was mice, sorry, they took older mice and younger mice, and they fed the older mice blueberry chow and then regular food to the younger mice. The older mice outperformed the younger mice on mazes. They learned how to do mazes faster than the younger mice. And the other thing is, you may have heard of this chemical. It's called acetylcholinesterase. It's the enzyme in Aricept, the medication for dementia. Blueberries have that naturally. Okay, so you're taking a natural Aricept. No, it's not the same quantity, but it is a natural antioxidant. All right, nuts. I love nuts, and I put the most common ones, some of the best ones up there for you. Nuts are great. Again, they have antioxidants, they have minerals, they have vitamins, fiber, essential fatty acids. Probably one of the best ones is walnuts. Walnuts have omega-3 fatty acids, and it does reduce your cholesterol. Cashews, for walnuts, 1 handful of walnuts has the same amount of omega-3 fatty acids as a serving of salmon. So you can get it either way. For cashews, great for your brain and your spinal cord. They have copper and magnesium. Brazil nuts, they have selenium. And what's selenium good for? That's an antioxidant. Very good for prostate disease, and we're using it now for patients with neurodegenerative disorders like ALS, which is Lou Gehrig's disease. Almonds, this is my particular favorite. Almonds have lots of vitamin E and calcium, and they've been found to help with Parkinson's disease. So there was a very interesting Harvard nutritional study a few years ago that found that people who ate vitamin E rich foods like almonds had a reduced risk of Parkinson's after a couple of years as compared to people who didn't have a vitamin E rich diet. And again, like the other thing I was telling you about, patients who took the supplements, meaning they didn't eat food, they took the pill, the vitamin E pill, they had no reduction in risk at all. Theirs was the same as if you didn't even take it. So if you're going to have vitamins, get it from real food if possible. Pistachios, those are known as the skinny nut because I think you can get a whole handful for only about 120, 160 calories. These have lutein. These are very good for your eyes. And they have B6, which can be good for your nerves in small amounts. And finally, what kind of nuts do you buy? Yes, I know the honey roasted are good or Cajun spiced, but you want to get them raw if possible or roasted with no salt and no honey. Okay? All right. Can you guys see this? Dark chocolate? Yeah, everybody looks up. Yes, chocolate is good for you, okay? But dark chocolate and in moderate amounts. They contain something called flavonols, and these can help fight heart disease and dementia and stroke. Part of it is because it opens up your blood vessels. Dark chocolate does. And it increases blood flow to the brain. So there's the Kuna Indians, K-U-N-A, Kuna Indians. I think they're in Central America. And they drink 5 cups of dark cocoa, not Nestle Quick or anything like that, but they have their real, pure, dark cocoa. And they drink 5 cups a day. Their blood pressure numbers are perfect. Perfect. And they have reduced instances of cancer, high blood pressure, stroke, and diabetes. So it is good for you. Now, there was one great study that more pertains to the Western culture. There were 19,000 patients followed in Europe over, I think, about 10 years. And they found that those people who ate chocolate, 7.5 grams a day, had a 40% reduced risk of heart disease and a 48% reduced risk of stroke compared to those who didn't have as much chocolate. So 7.5 grams of chocolate, how much is that? That's about, you know, those Lindt truffle balls. I think I've got a picture right there. It's about 2/3 of a Lindt truffle ball. Or for the rest of you like me who doesn't have that classy taste for chocolate, it's about 1.5 Hershey Kisses. Okay? All right. The next one is curcumin. The other word for it is turmeric. And this is a yellow spice you can find at the grocery store. They use it in Indian cooking, like in curries and things like that. It's got a very mild taste. You can barely taste it, but it just makes everything yellow. I'll put it in eggs or I'll put it in rice. And this has been found, again, it crosses the blood-brain barrier. It goes straight to the brain, has great antioxidant properties. It's been shown to be helpful in mice with traumatic brain injury. They can learn new things better, even after brain injury, if they're fed a curcumin chow. The problem is, and you're going to see it, it's in the newspapers, it's in magazines, it's on all these TV shows, it's so good for you. The problem is, it's good if you're a mouse. I'm not sure, there's not enough studies that show that humans can take enough to have a good effect. Now, they did find that it might be helpful in cancer at about 4 grams a day. Okay, and it does have some GI side effects. It can cause some tummy pain. So the jury's still out. If you want to try it, fine, but otherwise there's not enough evidence right now. Vitamins, B12, big, big, big. I check this in almost everybody who comes through my door. It is needed for the brain, the spinal cord, the nerves, the eyes, and it's one of the most common vitamin deficiencies in patients over the age of 55. They found that about 14% of patients will be missing B12, okay? The worst case of B12 deficiency I ever saw was a young woman. She was maybe in her late 40s, and I think she was on a fad diet. I can't remember. She was a little off, but she ended up blind because it affected the nerves to her eyes. She became confused and demented. She was, it damaged her spinal cord. She was in a wheelchair, and then her nerves were damaged. So she had numbness and tingling in her feet, too. And those are all permanent. So for all of you, when you go to your routine doctor, make sure they're checking B12. And the other thing is, make sure that they're checking another marker of B12. It's weird. You would think that B12, I want to have my B12 checked. That's not the best marker. There are the two other things. I put this on the slide. It's called homocysteine and methylmalonic acid. These are fancy schmancy chemicals, but they are better markers. If these are abnormal, they can tell you that you're deficient in B12 better than the B12 level itself. So you can ask for that. And then folate. So this is, what pregnant women have to have so that their baby's brain forms well. The studies are controversial in older patients for dementia and stroke prevention, and it's usually in combination with B12, but I think it's just important to have it as well, but not as important as B12. Vitamin E, we talked a little bit about that with almonds. You can find it in spinach, green leafy vegetables, avocados, and nuts. Again, try to get it in real food. Vitamin D, you guys may be okay in Vegas. Everyone else south of Atlanta or north of Atlanta has a vitamin D deficiency. I think mine is it was 14 a couple years ago. But anyway, they found in an Italian study that 60% of patients, there was a 60% increased risk of dementia, or at least a decline in your ability to answer questions if the level was less than 25. Vitamin D, again, you can take it from a pill, but it's also good to be in the sunlight. Make sure that you're getting enough shrimp or milk, fish, eggs, or mushrooms. That all has vitamin D, okay? And then B6. So the B6, I'm more worried if you have too high of a level of B6. Too high of a level can damage your nerves. It's weird. It's too little can, but more often than not, I see patients with levels of B6 that are through the roof. So just be careful. You don't have to take a supplement just for B6. B12 is okay. You can never have too much of B12. B6, be careful. All right. So food preservatives. So these are the things you should be careful about when you go to the grocery store. Food preservatives, you don't even know. These are chemicals, right? BHT, BHA. When you start looking at food labels, these are potentially carcinogenic, meaning you could potentially get cancer from it, or it could stimulate cancer. We don't know. Castoreum, show of hands, does anybody know what castoreum is? All right. Who's drank some kind of berry-flavored drink in the past, like a false berry-flavored drink? Anybody? Like Snapple or kind of berry-flavored tea? Anybody? Nobody's going to be, one guy, two guys, three guys. Castoreum is the berry flavor, okay, in many of these drinks. Do you know what castoreum is from? It's made from beaver anal glands. So anyway, that's castoreum. That's why I tell people, go to the grocery store, eat what your grandma told you, eat real food, okay? Just get fresh fruits, fresh vegetables. Do you need to get organic? If you can afford $4 a pound for an apple, fine, do it. But I will pick and choose which ones I'll buy organic because I can't afford it. I work for the Cleveland Clinic, okay? So just pick and choose, all right? And there's something called the Dirty Dozen. Peaches are on there. Nectarines are on there. Anything with a thin skin. The berries are on there. I will sometimes choose to get organic. Artificial flavorings. So artificial sugars. I know that some people are diabetic, but artificial sugars, and they take Splenda and things like that, but some of them could be neurotoxic. We don't have enough information. But I would rather just have a little bit of honey than get artificial sugars. And then, of course, MSG. Everybody's heard of MSG. Anybody who's eaten Chinese food, right? MSG is in there, can make you have a headache. But MSG has been found to be neurotoxic as well, especially in animals. They found that baby mice whose mothers had been fed MSG food when they were pregnant, they had less neurons, less brain cells at birth than those who had not gotten any MSG. So I would be careful. And the other thing is, these food companies, they know that you know to look for MSG, so they call them different names. Be careful. Yeast extract, hydrolyzed plant protein, calcium caseinate, vegetable protein extract. Those are all other names for MSG, so just be careful. And finally, pesticides. Again, with the organic foods, if you can afford it, then do it. But otherwise, the Dirty Dozen, which again, I think the berries are on there, the cherries are on there, the peaches are on there. You would choose to get those organic, okay? I love this slide. This is one of my favorite slides, and it talks about pesticide use. So the Yaqui Valley in Mexico is a very agricultural center, okay? And there's the foothills, and then there's the valley, okay? They both grow food. Well, a few years ago, the people in the foothills, they decided, we don't want to use pesticides, okay? So we're just going to keep doing what we're doing. And then the people in the valley said, well, we want to increase our yield, so we're going to start using pesticides, right? Years later, a psychologist went over there, and she tested the children. She wanted the 4- and 5-year-olds and some 6-year-olds to draw a picture of a person. That's all she said. She gave the piece of paper, she said, draw a picture of a person. So you can see, I think you can see my arrow here, right? On the left, or I don't know, it says foothills, this side. Can you see my arrow okay? It's on the, I think it's on the left side for you. These are the 4- and 5-year-olds and the 5- and 6-year-olds from the foothills. You can see there's an eye, there's eyes, there's nose, there's a mouth, there's a person, right? You can tell. Then they had the kids in the valley draw a picture of a person. Completely different. And especially when you look at the younger kids, I mean, what's that, right? That is sad. This is taking away from hand-eye coordination and cognition of the children, potentially from the pesticides. And then, of course, we want to eat mindfully. And I am one of the perpetrators of this. I eat while I'm working on the computer. My keyboard is disgusting. There's food all over. So, but eating mindfully is important because you get full, all right? If you're just chatting away and reading things and working, you're going to be hungry. But if you're actually taking the time to taste your food, you can enjoy your food, and it will decrease your calorie intake. A couple things you can do is in between bites, you can put your hands in your lap, okay? Have a glass of water or a sip of water in between bites. Before I go out to eat, sometimes with my friends, I'll have an apple. I'll pre-eat, and then you won't be wolfing your food down. All right, let's switch gears a little bit. Nelson Mandela, right, the late Nelson Mandela, he was imprisoned for almost 30 years. And to keep himself sane, what he did was he said, exercise is an inflexible discipline in my life. So he exercised every day in his little itty-bitty cell. He did cross-training. He did finger push-ups. He did an old boxing routine. He jogged in place. He did sit-ups. He was very, very active. And it helped him so that he didn't, lash out at the guards and be very, very angry and hateful. But exercise in and of itself is good for all of us. It helps to reduce the risk of heart disease, stroke, diabetes. It helps my patients with neuropathy and many, many other diseases. There was a really important study done in Finland. They looked at 1,400 patients. They followed them for 20 years. Can you imagine? 20 years, 1,400 patients. And they found that middle-aged adults who exercised twice a week in a moderate amount, okay, they had a 50% reduction of risk of dementia and a 60% reduction of Alzheimer's compared to those who didn't exercise as much. But the best thing is those who had what's called the ApoE4 allele. Has everyone heard of that? That's a gene that predisposes you to Alzheimer's disease. Those who had that gene but exercised twice a week reduced their risk to those who didn't have the gene. They beat their own genes. So exercising at least twice a week is important for everybody. And why does it help? The scientists aren't 100% sure, but they think it has to do with something called autophagy, which means self-eating. And what it does is the body learns how to recycle used proteins. Okay, so it just becomes more efficient and you metabolize better. That's one of the reasonings. But it also helps with your mind. All right? So what I tell my patients is, I don't care what you want to do. Just pick something. It doesn't matter. Walking, Zumba, swimming, I don't care. Just do something, okay? My colleague, Matt Sutleff, he's one of our physical therapists. He's the chief physical therapist at the neurological center here. Phenomenal. He works with dementia. He works with ALS. He works with MS, Parkinson's disease. Great. He came up with something called the 4 rules of exercise. So number 1, pick something you like or you can tolerate, okay? Because if you hate swimming, guess what? You're not going to swim anymore. So if it's walking, it doesn't matter. Like I said, just pick something you like, okay? Number 2, and this is maybe one of the most important things, because patients are always asking me, well, how do I know if it's too much? How do I know if I'm hurting myself? So this is called the 2-hour rule. If after you've done something, I don't care, like let's say you just ran for 30 minutes, if 2 hours later you feel worse or tired, that was too much, you need to go back and reduce that, maybe to 20 minutes or 15 minutes. So again, it's the 2-hour rule, okay? Number 3, try to do something every day. No, you don't have to run a mile every day or, do 20 push-ups. But, if it's raining outside and you're watching Dancing with the Stars, just do leg lifts while you're watching Dancing with the Stars. Or walk around your house 5 times. Just do something. And number 4, no pain, no gain does not apply to patients with neurological conditions or chronic illnesses because you could hurt yourself. If it hurts, just stop. Now, if you're young and healthy, go for it. But like I said, I'll tell my patients, use your body to tell you when it's time to stop. All right. For those people who want to take it a step further, you can do cross-training. And when you cross-train, you look for flexibility, which is like yoga, Pilates. You look for balance. Again, yoga and Pilates are good for this, but Tai Chi and Qigong can be good for this. Aerobic activity would be swimming, running, walking quickly, and then strength training, okay? Low weights, more reps. That's what I usually tell my patients. All right, we're going to switch gears one more time, and we're going to talk about mind-body therapies. Specifically, we're going to talk about meditation. Now, meditation has been around for thousands of years, and it was initially associated with some religions, but now it's non-denominational, and we're using it more and more in Western medicine to help patients with chronic neurological illnesses and chronic medical illnesses. Now, one of the definitions of meditation from a psychology textbook was it's a family of self-regulation practice that brings your mental processes under voluntary control through focusing, attention, and awareness. Very important. You're bringing everything so that you can control it using attention and awareness. And again, 17% of the population right now takes part in some kind of mind-body therapy. Now, there are many kinds of meditation, okay? And I put some of the common ones here. Mindfulness is, everybody talks about mindfulness. What is mindfulness? It's non-judgmental awareness, meaning when something happens, when you see a thought, when you see a pain, when you have a sensation, you see that objectively. You look at it from afar, and you just say, okay, this is a thought, this is a sensation, and you let it go. No judgment, no emotional baggage, you just let it go. Concentration is when you focus on a particular thing. Like some Catholics will focus on their rosary. Christians or Protestants will use their crucifix. You can focus on your breath. You can focus on a chant. You can focus on anything you want to. Transcendental, or TM, the Beatles did this. I don't know if anybody remember, the Beatles were totally into meditation for a while in the 1960s. And the Transcendental Meditation, or TM, they focused on a mantra. A mantra is a chant. So they'll have a special chant just for you, and you just say that over and over again, and it focuses your mind. And then, of course, other things like yoga, Tai Chi, Qigong, these are, some of them are Chinese exercises, that focuses your mind as well. Attention. What's the big deal? Well, it's a huge deal. Attention and awareness, that's what psychologists call the foundation of complex cognitive activity. It is the bedrock of our thoughts, okay? You got to have attention. With lapses in your attention, we know from the sleep literature, we know from drug and alcohol intoxication studies that any kind of lapse in attention can be potentially disastrous. there was an interesting experiment. It was a pseudo-scientific experiment. 2020 did it a few years ago. And what they did was they took two groups of people. One, they gave them booze, all right? They got drunk. And they measured all their blood levels of alcohol, and it was all above the legal limit. Then they took a second group, and they sleep deprived them. They didn't let them sleep for a couple days, all right? And then they both got put onto a closed car track, a race car track or whatever. It's a closed track. And they were driving a car, and in the path would be these cardboard cutouts, right? It would be like a trash can or a mother pushing a baby carriage, okay? And just to show what sleep deprivation and alcohol do to our attention and awareness, who do you think performed worse? Guess. The drunk people or the sleep-deprived people? That's right, the sleep-deprived people. So the people, the baby carriage, right, the mother pushing the baby carriage, at least the alcohol people had tread marks or skid marks, right? They tried to stop. The sleep-deprived people ran them right over, okay? So attention is so important. Now, even little minor lapses, like when you're in a meeting or when you're in a boring conference, hopefully not this one, but what do you do? What do we do when we're bored? We daydream, right? And daydreaming can be harmful. And the reason why is because daydreaming serves no purpose, right? And it competes for the same resources that you need for important functions like memory and recall and more executive functioning. They did a study where they found that doodling is better than daydreaming. So they had one group of people, they were allowed to doodle, and another group of people, they just had to sit there and listen, and they played a super boring phone message. It was, "Hi, this is Jackie. My party's on Thursday at 7. I think John and Mary are coming at 8, but they were in a fight, so I don't know if John's coming." And on and on and on, it went for 20 minutes, okay? And the thing is, at the end of the study, at the end of the phone call, you had to remember who's coming to the party, what time the party is, and details like that. The people who doodled were remembering 30% more than the people who daydreamed. So again, attention is very important. And that's what meditation does. It focuses your attention. And we know from clinical studies that if you can focus your attention through meditation or other practices that can do that, you can change your brain. You change the function of the brain. You change the blood flow to the brain. So it does work. Now, so we talked about it can actually increase your brain mass in the learning and memory sections, but it can affect your body too. It can improve blood pressure. High blood pressure patients did meditation for a while, and they had improved numbers. Insulin resistance in patients with diabetes, their sugars got better. You can even live longer. So they took these patients who had been followed for almost 20 years, people who had participated in meditation studies, for various things. And somebody called them 20 years later, and they said, "Hey, what's going on?" And they found out that they lived longer than people who hadn't meditated. It's because there was a control arm in those studies. So they were able to get in touch with them, and they found that the people who had meditated had a 20% reduction in mortality, were less likely to die than the person who didn't meditate. So, again, it has a lot of very good physiological effects on the body. Now, these are small studies. I don't know if you can see this. They were very small research studies, not anything we can make definitive statements about, but it can help with a number of illnesses. You can see high blood pressure, cancer-related symptoms, substance abuse, anxiety, PTSD. They're doing PTSD now for our veterans coming back from Iraq. And this is important because these people who fought for us overseas are now in trouble. And I think everybody knows about what's going on with the VA, and this is helping them. Now, Parkinson's, migraines, Alzheimer's disease, they have also been helpful, or they have also been helped by meditation. The Parkinson's patients, what they did was Qigong, which is a form of Chinese movement meditation, and they were able to improve their movement scores, which is great. Stroke, they were able to see more vasodilation, meaning the blood vessels got bigger with meditation. Epilepsy, the studies are still out. It's not sure if it makes it better or makes it worse, but everything else seems to be better. We did our own study. My mother is a Buddhist monk in Thailand. She used to be a soccer mom. It's a long story, but she's now a Buddhist monk, and we imported her from her rainforest temple in Thailand, and she did a study with us. And I did this with some of my MS colleagues, or multiple sclerosis colleagues, and what we did was we took 22 patients with neuropathy or multiple sclerosis. For 2 months, we did weekly meditation with Tai Chi, Qigong, and sitting meditation. And at the end of the study, they had reduction in pain, improved quality of life, and improved fatigue. They also said things like they had increased balance. Their blood pressure was better at their primary care physician visits. Their pain was more manageable. And they had inner peace. And of course, meditation has effects on the mind. It reduces stress and depression. It can reduce the relapse rate of depression. It reduces anxiety and improves mood disturbances. All right. So why should you practice meditation? Well, everyone in those rooms out there, I can only see CCF Vegas, sorry, but I'm sure that everyone else, every one of you has had to work hard to get where you are right now. No matter what you did in your life, you survived this far. And life ain't easy, okay? Ever since you were young, you were taught to think, to problem solve, to reason. You had to balance school with work and children and a family, and it's just crazy, and a job. And this is life, right? And that's fine, because that's what we had to do. But then along the way, we picked up stress, anxiety, disappointment, regret, worry, all of those things. And it becomes this emotional baggage that we regurgitate, and it's stored in our mind, and it comes out again and again and again with certain situations. Meditation can help reduce that, okay? It takes us away from that. We are always thinking in our minds. It's this constant internal dialogue. Did you know, psychologists found out, that 90% of the thoughts that you have today are the same thoughts you had the day before? Exactly the same. And it's embarrassing. What are our thoughts mainly about? Ourselves, right? But the thing is, meditation stops that. We start to look at the space in between the thoughts, okay? And that's what mindfulness is, learning how to be in the present moment. But what's so great about being in the present moment, right? Everyone says, oh, be in the present, be in the present. But the thing is, what if you're getting a root canal? You don't want to be in the present moment, right? Or you're going through a bad emotional time with something that's happened in your life. You don't want to be in that. But the thing is, with meditation, but even in a good circumstance, let's just say that you're looking at this beautiful valley and there's mountains and beautiful sky, and you think, wow, this is so beautiful, just like a postcard. And then a few minutes later, what happens? Oh, this is so lovely. This is so nice. In a few minutes, what happens? Yeah, this is really great. And another more minute, yeah, what was I supposed to pick up at the store again? It's because our minds are always going like this. And meditation helps us stop that. We stop that because that's what causes our suffering. All the thoughts that come again and again and again. Meditation will get us into that space in between the thoughts. And that's where peace is. And that's why being in the present moment is important. Because you're not in that internal dialogue. You're right there. Okay. So, as I said before, there's many types of meditation. The two most common types, the two easiest types, are concentration and insight meditation, or mindfulness. So I'm just going to talk to you. For concentration meditation, you can do anything. Probably the easiest one is concentrating on the breath under your nose. You can feel it, cold, warm. You can count them, it doesn't matter. Or you can put your attention right here, right there, right above your navel, and you can just feel it go in and out and in and out, okay? There's ice cubes. You can do movement meditation. In Thailand, they're pretty hardcore. They'll go to the cemetery, and the cemeteries in Thailand are not like the cemeteries in America. It's not beautiful, not lush with the headstones. They're poor. They throw the bodies in there, and the bodies just kind of rot until somebody, does something and puts them in the ground or burns them. So they'll go into the cemetery and just meditate on the dead bodies. So you don't have to do that. You can do your own breath. Okay. And then mindfulness meditation, it is moment-to-moment awareness. Again, this is when you see a thought as just a thought, and then you let it go. And you don't get caught up in it. This is great for patients with depression, because people with depression, what they do is they dwell, right? And I read this example in a psychology article. It's where a patient will say, let's say a patient asks out a woman, okay? And the woman says, no, I don't want to go out with you, right? A normal person would be like, you're lost, right? Or, oh, well, okay? But a patient with depression will think, she doesn't like me. Nobody likes me. Nobody loves me. I'll never find anybody. And the thoughts will recur again and again and again until you drown yourself in all of these thoughts. And that's when you have depression. But when you practice mindfulness meditation, when you see that thought come where they say, she doesn't like me, nobody loves me, you stop it right there. You say, this is just a thought. This is not a part of me. This is not me. That is just a thought. And you let it go. Okay? Same thing with chronic pain. Patients with chronic pain, when the pain comes, they can see, all right, I can be with the pain. The pain is not a part of me. And you learn to live with the pain and know that it's not you, okay? And just be objective about it. And then, of course, there's walking meditation where you go really fast, okay? And you just let things come and go. Go by yourself. Don't go with a Walkman. Don't go with friends. Don't go with your dog. Walk quickly on your own and let things come and go, all right? Qigong and Tai Chi, and these are movement meditations. Your mind is focused on the movement. It's right there, and it's easy. I like this. For some people who are too obsessive, mindfulness meditation in the form of Tai Chi and Qigong is very good for you because you're doing something, right? It's kind of a distraction. And then I talked a little bit about the concentration meditation and the mindfulness. And then we're doing one more little turn here, but this is the spiritual aspect. And if I have time, and if I know that a patient has, spiritual issues they want to talk about, I'll talk about giving, okay? To give is so... One of my friends once told me that if you're feeling bad about yourself, if you're having a really bad day, or you're just feeling kind of down, what you can do something for someone else. It doesn't matter. I mean, it can be giving somebody directions. It can be smiling and saying hello. It can be listening to somebody talk about something that's important to them. I mean, just this morning, one of my residents, her grandfather just died. Another one of my nurses, her father just died. Another one, her child is sick in the hospital. And if you just stay just those 2 minutes or 3 minutes and just listen, that's giving your time. That's giving your attention, okay? You've helped another person. You've put your own needs below that of somebody else. And that is liberating, okay? Because most of us, and it's not a bad thing, it's just normal, we're just egocentric. We're just a little self-centered. Not selfish, not bad. It's just that we're always talking about me, me, me. But when you give something to somebody else, it just brings you to a higher level of being. And the Quakers have a saying. They say, proceed as the way opens. Meaning, sometimes in your life, you're going to be stuck, okay? You're going to be in a bind, and you don't know what to do or where to go, and you don't know how to go through. But sometimes if you've done good things in your life and you've helped other people, it creates a lot of positive energy. And before you know it, something opens for you. So just proceed as the way opens. And finally, acceptance. So Karen Mulcahy was the CEO of Xerox when it was a multi-cajillion-dollar operation. And one of her favorite pieces of advice that she kept up here throughout her tenure as the CEO was something she'd learned in a business meeting in Texas from an old Texas businessman. And he said that when everything is going kind of crazy, right, and you're overwhelmed and everything's just out of whack, just take a minute, all right? And if there's a problem, just take a minute and figure out 3 things. Number 1, figure out get that cow out of the ditch. If the cow fell into the ditch, number 1 is to get that cow out of the ditch. Number 2, figure out how that cow fell into the ditch. And number 3, don't let that cow fall in the ditch again, okay? And that's what it is. It's called the cow in the ditch. All right? So instead of thinking, oh my God, I can't believe the cow fell in the ditch. It fell on my watch. Everyone's going to think I'm terrible. Everyone's going to think I'm stupid. No. You're adding insult to injury. So for acceptance, just change the things you can change. Figure out how it was like that and make sure it doesn't happen again. And if you can't change it and the cow is stuck and you've done your best to try to get that cow out, you just accept it. Okay? That's just the way it is. That's just the way it's going to be. And it's easy to say that. It's easy to say, oh, we'll just accept it. This is life. It's not that easy to do. But if you have patience with yourself, if you're kind to yourself, and you do meditation, and you give, and you try to make a difference in your life, acceptance will come. And that's how you can get through life. Okay? So that's my holistic path to health and happiness. Again, the 3 basic tenets: nutrition, exercise, and mind-body training. The spiritual side, giving and acceptance. And then to close with a story, this is my mother's meditation retreat site in the rainforest of Thailand. It's in the southern peninsula. I don't know if you can see it. There's pine trees or palm trees. It's beautiful there. She takes one student at a time, and it's all free for 7 to 10 days. Well, I pay for it for everybody. But anyway, it's totally free, and she becomes your life coach. She's like the Asian Oprah. She's wonderful. But a story that she told, and it's in the book as well when you get it. So we did a meditation retreat for the wounded warriors coming back from Iraq. We did it in North Carolina several years ago. And there was a young guy who stood up and he said, what do you do if you did something bad, really bad, but you can't go back and change it? And you had to do it to save the lives of your men. What do you do? How do you live with that? And of course, we kind of could guess what he was talking about. I mean, who knows what happened in the desert, right? And what he had to do to survive, to save the lives of his men. So my mom said this, and this is an old Buddhist saying. She said, imagine a cup of salt. If somebody gave you a cup of salt to drink, there's no way you could do it, right? It's just too salty. But if you add water to it, a little bit more, and a little bit, and a little bit, and a little bit, until finally you have a swimming pool full of water and just a little bit of salt, you can drink it. It's diluted, right? The salt is still there. You can't take away the salt, but you can drink it now. And the same thing with your life. Whatever we did in the past, it's there. You can't go back and change it. I wish I could go back and change things, but you can't. This is the way it is. But if you change your life, if you add water by doing good things for people, doing good things to yourself, treating your body better, being more giving, being kind, being patient, and accepting things as they are, if you can do that, that's adding water, and that will make your cup of salt a little bit easier to swallow. So that's all. Thank you very much. And